All right, this is the third in a set of gastrointestinal parasite videos I am making, and we are going to move on to Cystoisospora belli. This is a sporozoan, so we're moving away from amoebas and moving into the sporozoites. These organisms are intestinal parasites of blood and tissue. They're a protozoan. So they demonstrate typical characteristics that you probably already learned with Plasmodia. Specifically, they have an asexual or schizogony or sexual or gametogony reproductive cycle. So if those words aren't ringing a bell, go back and review your Plasmodium life cycle because that's the one you have to know. The first of the sporozoans that we will discuss in this case is Cystoisospora belli, but we have discussed other ones, particularly Plasmodium. The other thing that I just want to point out, this one is now known as Cystoisospora belli, but it was formerly known just as Isospora belli. It's a coccidian parasite of the intestinal epithelium. So if you're trying to classify these as you go through your studying, that's another buzzword that you might want to keep in mind, that it's a coccidian parasite. Okay, let's talk diagnostic and infective forms. So remember, this one has both an asexual schizogony and a sexual gametogenesis component. So the diagnostic form for this one is actually the oocyst, which is the end product of gametogenesis, and it can be found in fecal specimens, so that makes it really easy. Infective form, the ingestion of the immature oocyst. Okay, so the oocyst is going to mature as it goes through its sexual reproduction. So the immature oocyst with the sporocyst, that's how we get infected. These are actually what are excreted in the stool of infected individuals. So that means, once again, we're looking at a fecal oral route, right? And anytime we're looking at fecal oral, you also want to keep an eye on oral anal sexual practices as a potential route for transmission. How does it cause disease? Really, it causes disease by existing. That sounds terrible, but it's kind of true. Basically, you get sexual and asexual reproduction in the intestinal epithelium, and that's what leads to tissue damage. We can find it everywhere. It's worldwide, but it's really not often detected in stool specimens. So even though it has a worldwide distribution, we don't see it all that often. The parasite, though, is being reported more frequently in both healthy and immunocompromised patients. So this is one of those parasites that's on its way up. Patients are exposed by eating contaminated food, drinking contaminated water, and as I mentioned, oral anal sexual contact. All right, clinical syndrome. As with most of our parasites, most patients are going to be asymptomatic carriers or suffer kind of a mild gastrointestinal distress, which can progress to severe GI disease. Disease mimics giardiasis. So if you haven't watched my Giardia video yet, go back and watch that one. You can see a malabsorption syndrome with this one as well. That's characterized by loose, foul-smelling stools. And then if you have chronic diarrhea, you're going to expect to see weight loss, anorexia, malaise, and fatigue as the patients become dehydrated and lacking nutrients and electrolytes that keep all of those systems up and running. So how do we diagnose it? Basically, you're going to want to directly examine concentrated stool sediment. So that's what this is showing, and we're actually seeing the organism right there. But you can also do a modified acid fast procedure, similar to what we do for like tuberculosis. So in that case, that's what I'm showing here. You can also do a small bowel biopsy to establish the diagnosis when results of tests on the stool specimens are negative. So if you're really trying to chase it down, like in a chronic patient, that might be something you would do. Treatment, trimethoprim sulfamethoxazole seems to be the drug of choice. How do we avoid it? Good personal hygiene, clean water, safe sex.